excited to be here with you today, but this is a moment for us, right, Matt, to be up on this stage. And so we wanted to create a little bit of a moment. And what we're going to be talking to you today about is the concept and power of what if and how we deploy it at Startup Health and what it meant for the Queens healthcare system. So what I want to do is record a little video up here. We're going to do like a video selfie. And I want you guys, when I end my sentence with the words what if, to say what if as loud as you can 3 times. Do we think we can pull this off as a group? All right. So let's practice. I'm going to say what if right now. We're going to give it a quick shot. So what if?
What if?
All right, we need to do that a little louder and better. Let's try it one more time. What if?
What if? What if? What if?
All right, we're going to pull this off. This has never been done before on a Startup Health stage. And depending on how it goes, it may never be done again. All right, so I got to flip it around. All right, here we go. It's Matt Koenig at JB Edwards, live from the Startup Health stage in San Francisco. Some of you might know there's another small conference in town that annexes themselves to Startup Health called the JP Morgan Healthcare Conference, but no one is here for that. We're here for Startup Health, and we're here to explore today the power of what if.
What if? What if? What if?
All right, I think that worked. All right, so it'll be, you guys can catch it at Jamie Edwards on Twitter. All right. So I'm Jamie Edwards. I'm the CEO and co-founder of Cloudbreak Health. My other co-founders in the audience today, Andy Panos, and I'm here with Matt Koenig, who's the director of telemedicine at the Queens Health System in Hawaii. And today, we're going to spend time talking about what if. And at Cloudbreak, we love what if. It is the engine that gets us going. And I feel like in healthcare, sometimes with all the regulation and everything that happens, we don't spend enough time asking what if. But we do, and we do it on behalf of our clients. And we think about questions like, what if healthcare wasn't a have to, but a want to? And what if people flaunted their healthcare in the same way they might a new car, a new house, a handbag, or a new haircut? And what if the goal of the healthcare system was actually to ensure that we didn't need it? And you have to think about that one for a second, right? We've built a healthcare system that sustains itself on the revenues that come in from it. But ideally, we're all focusing on preventive health and wellness in a way where you don't really need as much acute care. And what if we realize that healthcare is largely a social issue and largely a behavioral issue, much more than it's even a medical one? So I think at this point, you get the point. And that point for us is that we believe that finding the answers to what ails our healthcare system are really about asking the right questions. To ask the right questions, you need some inspiration. And for us, that inspiration is Rocket Boy. We have Rocket Boy plastered up all around our office. And you look at this kid, and we're talking about moonshots, right? We're strapping on a helmet, we're putting on goggles, and we're throwing a rocket on our back, and we're going to the moon. So for us, he drives all of that what if. And what if age didn't jade us? And all of our experience didn't teach us all about the won'ts and the can'ts. But what if we remained with these limitless expectations that help drive answers to what's ailing the healthcare system? He's become our mascot. And so I've kind of done a little bit of an allegory up here where we say, what if we spent more time looking up? For us, that looking up is actually eye contact with the patient instead of time looking down. And if you talk to most clinicians today, they spend an inordinate amount of time looking down, staring at a computer screen, filling out an EMR, as opposed to really just connecting with the patient. So for us, that really meant, what if we spent more time building bridges and less time building fences? So there's obviously a million of what if questions that could be asked, and you could lose yourself in all this daydreaming. So at Cloudbreak, we match it with our how can. And the how can for us is our mission to humanize healthcare. And that mission was born out of my time as the CEO of an ER group called Emergent Medical Associates in Southern California. And I saw doctors on the front lines of care being asked to do more with less, being faced with higher regulation, higher malpractice costs, working 8, 10, 12, sometimes 24-hour shifts in the ER, and just trying to get through their day. And what I saw firsthand was the fact that these physicians were burnt out. One of the most important workforces in the country burnt out. And I don't know about you, but they suffer burnout 2 times the amount of the normal American who's working today. And I want my physician not burnt out, but focused on my care. And I want him not treating me or her treating me like a statistic. And we realized at the same time that while these physicians were being asked to do more with less and suffering from burnout, that they weren't being treated very well by their patients. that we as patients had these expectations about how that care was supposed to go and we felt entitled to it. As you can see, there's a broad variety of other issues that are rife throughout the healthcare system. So the team at Cloudbreak asked, what if? And we asked, what if we could restore the joy of calling back to these clinicians? And what if we could put tools and technologies at their fingertips that help them build connection, rapport, and trust? And we heard Bernard Tyson talking about the climate and the planet. What if telemedicine was a key to helping make our planet a safer and healthier place? Because you no longer have to travel for your care, and hospitals can be smaller and therefore use less resources and less commitment. So what if people could access their physician anytime, anywhere, and in any language? And interestingly enough for us, given the diversity of the country, that language use case proved to be the one where we saw the most fruit in the beginning and where we could get the most traction. So our what if became, what if we could level the playing field for limited English proficient and deaf and hard of hearing patients and make sure they receive the same standard of care as your English-speaking counterparts. So I want you to meet Marty. Marty was named by Andy Panos, who's in the office. Who's in the audience, and it stands for My Accessible Real-Time Trusted Interpreter. And this was our first healthcare disparity solution. And Marty is one of the most successful telemedicine solutions in market. It's currently used 85,000 times per month at over 1,000 hospitals across the country, over 10,000 video endpoints. You hit a button, and within normally around 30 seconds, you're connected to a live certified medical interpreter. So communication is the number one diagnostic tool that a patient has and a provider has, right, in terms of making that diagnosis. Without that communication, defensive medicine results, you have issues with customer service, and there's a ton of anxiety. Marty helps solve all of that. And it's pretty amazing. The stories that come out of the use of the platform daily are physician empowerment, patient empowerment, the ability to take control of their care for what is a growing part of our population here in the United States. But at Cloudbreak, we believe that technology isn't the hard part. The problem is most healthcare companies out there, or a technology company, they're using their technology to drive the solution as opposing to let the solution drive the technology. And we spend an inordinate amount of time in our business making sure that we are actually working towards something and that we're asking the right what-if questions. And so as a result, our goal was in any device, anywhere, anytime, any language solution that leverages the hardware already in place at our facilities. And you'll hear a little bit more about that later on. So the solution includes three major pieces. One is the collective, which is the marketplace. The other is Connect, which is the network. And finally is this concept of telemedicine as a service, which is the software. So we understood that the infrastructure that we already had in the field had value. And what if when our screens were dark or not doing language interpretation calls, they could be doing other things? What if they could be doing a telestroke call? What if they could be doing a telepsychiatry call? What if we could have an entire care team, an entire care continuum surround a patient? And that's exactly what we set out to do. And so our solution bundles the software, the broadband network, and the marketplace, and it's really a clinical video collaboration tool. And we realized it could be used to help solve other types of healthcare disparities. And so we moved to do that. How could we solve physician shortages, nursing shortages? How could we ensure that patients weren't going to the ER, which is the highest cost venue of care? And so we've deployed the platform to do exactly that. And when you hear articles, because I've seen a lot of them lately, that say telemedicine isn't being adopted or isn't driving change in the healthcare system, I can tell you it's flatly wrong. The telemedicine solutions that are in market right now are saving millions of lives every single year across the country. And so it's now my great pleasure to introduce, again, Matt Koenig, who is one of our partners. They started off as a language services client and now are moving into the next phase of development on the Cloudbreak platform. Matt?
Thanks a lot, Jamie.
Here you go, bud. Good handoff.
So excellent handoff. So I'm the medical director of telemedicine for Queens Health Systems and a practicing neurologist in Hawaii. And don't get me wrong, I mean, living in Hawaii is paradise, but even paradise has some problems. And there's 81,000 people in Hawaii who are living with major depressive disorder. Couple that with a severe shortage of mental health professionals in the state that disproportionately impacts patients living on the neighbor islands outside of Oahu. And 1 in 4 people don't speak English in their households, which is the highest proportion in the US. at Queens, we have a mission, and part of our mission is to meet unmet healthcare needs in our communities, including mental health, and deliver the right care at the right place at the right time for our patients. The flagship hospital in the Queens system is located in downtown Honolulu, and we have great tertiary mental health facilities and professionals. We also have 3 other hospitals in smaller communities on the west side of Oahu, Molokai, and the Big Island. We also serve numerous outpatient clinics, critical access hospitals, and affiliated acute care hospitals that really have very limited mental health resources. So the joke when you ask patients where they go for great health care on the neighbor islands, they'll tell you the airport. The problem with that is that people living with mental health problems may not have that option. And distance and depression can be very isolating for those patients. I think we all know that telemedicine holds great promise for delivering mental health where patients really need it the most. Really patient-centered care that brings the mental health professional to the patient, not vice versa. But in order to meet that promise, it has to be accessible to patients. It has to be easy for providers to use and to learn, and it has to be affordable enough for healthcare systems to sustain it. Telemedicine traditionally has been siloed. You go out and get a grant, purchase a single-use piece of equipment that lacks interoperability with other use cases or projects. And so in partnering with Cloudbreak Health, the mental health professionals at Queens recognized an opportunity to leverage over 200 devices that were already deployed across the healthcare system and were already present on every island on the state, and to repurpose those pieces of equipment, not just for language translation services, but also for mental health services. And so rather than yet another siloed telemedicine project, this builds on a platform that delivers healthcare across the spectrum of care using a single technology that's already familiar to providers and easier for them to deploy. And so with that, I want to say thank you, mahalo, and we're really excited to partner with Jamie and the Cloudbreak team to get this project started, and it's kicking off next month.
Yeah, thanks, Matt. We encourage everyone to ask a little more what if in healthcare. Thank you guys for your time.